Well, my name is Dr. Runar Johnson. I've been doing dentistry for 50 years. Back in the late 70s, I got interested in TMJ, what they called TMJ therapy at that time. So my background has been to do excellence dentistry and then to treat people who are in chronic pain. We called it TMJ to begin with. Now I call it myofascial pain treatment because most of the people that I treat using the aligner are people who come into my office and they have chronic headaches, neck aches, backache, chronic fatigue, and various other symptoms that go along with a body that's stressed. So I was doing TMJ work for several years, making appliance therapy to balance the bodies, but we had no base mark to judge from what we were doing to the patients. So I was seeing my patients 3 or 4 times a week, making appliances, trying to adjust the appliances so that I could create a relatively good bite so the patients could be free of their pain. There were no parameters by which to judge what we were doing. In the early 80s, we ran across the concept of the HIP plane. That's the hamular notch plus incisive papilla plane that's created when mounted on the aligner. This gave us a parameter for judging what we were doing to patients and why appliance therapy worked. In treating patients, years ago when we got into dentistry, there were so many people with so many problems that the concept was overwhelming just to get the holes in the teeth filled and to keep teeth in the mouth. Now patients are more interested in their health. They want to come to the dentist to find out what the dentist can do to profit their whole health, not just the health of a tooth or teeth in the mouth. And so that's one of the reasons the aligner was developed, was to give dentists the ability to treat the whole body through the mouth, because I believe the mouth is the most important structure in the body to create balance in the body, homeostasis in the body, and health in the body. Shortly we're going to go into a discussion on how to mount and why we mount on the aligner and exactly what it's used for in the body. But I want you to understand that this was developed in treating people who are undergoing myofascial pain and chronic fatigue syndromes in their lifestyle. When patients came to me as a general dentist, I did an exam. I would ask them, "What are your symptoms?" They'd say, "Well, none of my teeth hurt." And I'd say, "Well, do you have neck aches? Do you have headaches? Do you have back?" "Oh yeah, I've got headaches and backaches, neck aches. My doctor says there's no treatment for that, so I just put up with it." My comment to them would be, "Would you like to get rid of that pain?" Of course, they were very interested in that. Now, I've treated probably 3,000 people or more, patients more, with my myofascial pain treatment using the aligner. And I would say at least 95% of them have gotten rid of all of their major pain problems. The reason for that is, whenever you have a maxillary or mandibular arch that's out of balance, out of plumb with the rest of the body, you're going to have pain. So the aligner was developed with a mounting system and taking specific impressions so we could tell whether the body was out of alignment and then putting the body back into alignment. Now I've got a little diagram here that illustrates what I'm talking about. You have several planes going through the body. You have a plane going through the eyes, through the mouth, through the shoulder girdle, to the hip girdle, to the knees, to the ankles. And in a structurally balanced, healthy body that has very little symptoms of any kind, adverse symptoms, all these structures will be at 90 degrees to the floor or horizontal with the horizon. If one of these planes in the body, one of these areas in the body is changed, then all the other areas of the body compensate to that change, because the brain is always trying to keep the body in structural balance, harmony with with the horizon. So, for instance, if I have a plane in my upper arch that's tilted like this, and that's the way I bite, and my arch stays that way. As soon as I have a plane that's tilted that way, my head is going to tilt to compensate to try and level that plane. And so how does my body tilt to level that plane? The brain does that through tightening up muscles in the neck, in the shoulder girdle, in the rib cage, and on down to the hips. And so if my maxillary plane is off, my head's going to try and compensate for that. That sets up a whole muscle system that goes back and forth down the body, and you end up with compensating curves in the body, which we call scoliosis, where the backbone goes like an S, or lordosis, when it goes front to back off, or a twist, which is in the body, a rotation in the body. All this is done by muscles to maintain perfect balance, the brain maintaining perfect balance through the body to the horizon, so you can walk without falling over, and walk down a hall without falling into the walls, walking into the walls, walk straight instead of staggering. So the aligner was developed for the purpose of leveling the body into structural balance. Once the structural balance is obtained, then other modalities that people seek out characteristically for their pain would be the chiropractor, the craniopath. In other words, the craniopath does the skull, straightening out the skull bones, chiropractor the backbone, the naturopath for health, osteopath for curvatures in the body. And so the aligner was developed to help solve all those problems. When the aligner was developed finally, I believe it's the easiest, most fundamental, versatile instrument to be used to mount cases on that the lab man can use to do a great job for the dentist. Not so important if you do just one crown, but if you're doing a bridge, two crowns and a ponic, or especially if you're making a denture or a partial, or a significant amount of the structure in the body has to be replaced in the mouth, then the aligner is absolutely the best instrument around that you can use to create that balance. Now this is the aligner. It's used to mount on. We put plates in the aligner to mount cases too. You would slip a plate in, tighten the plate so it doesn't come out, and then these rakes are 15 millimeters high. You would take an impression of the upper arch and set that upper arch on top of these plates. This is a case here that's been mounted, and if you look, you have the hamular notches and the incisive papilla and the maxillary arches put on the aligner. It's closed with plaster of Paris. After it's closed, then you end up with a system of being able to analyze where the body is and what the body needs. So after this is mounted now, we mount these. Always we have mounting points on the horizontal scale of the aligner. Once they're mounted, you take the rates off, and now, because this impression was taken showing the hamular notches, that's right here, and the incisive papilla, that's right here, those have to be in the impression. Those are the 3 points that this is mounted on. Okay, after the case is mounted, then you can lower the case down on the aligner. You can lower the case down on the aligner, and then you can look from side to side to determine if the maxillary arch is level. This happens to be on a patient who was having a lot of neck problems, a lot of headaches, a lot of chronic fatigue. And I mounted her to see if she was level. Well, if you look at this case closely, you'll see that on the left side, the only tooth that really hits is the second molar. Then you go over to look on the right side and you find that there's a space back here. There's no second molar. And then there's a space here where the first molar isn't even touching the table. So in this case, we know that this maxillary arch, instead of sitting horizontal to the floor, is sitting at an angle to the floor. So this patient's head is sitting like this to try and level this. It would try to bring this one down and this one up. So the brain is trying to get this head level, but it's not going to walk around with the head turned like this. Okay, the body's sensitive to microns. Microns are very small. The tactile sense in the teeth is up to at least a half a micron. That's very little. You can't even see it if you're going to adjust the occlusion, take a half a micron off, you can hardly see any tooth structure come off. That's what the body's sensitive to. Well, this is probably 2 millimeters at least on this side. So this arch is sitting like this, so the body's going to try and keep the head up like this. How's it going to do that? It's going to tighten muscles down through the neck, through the shoulders, through the torso, and you're going to have a scoliosis in the body. Okay? Because the patient's not going to walk around like this. The patient's going to walk around like this. To go from here to here, you have to have a scoliosis in the body to correct that structure. Okay, so, and generally when you have a patient with off like this, they're complaining, oh, I got stiffness in my neck all the time. Oh, and I got stiffness in my shoulder all the time. And I got stiffness in my hip over here all the time, because it goes down like this through the body. Well, I can't go into all the detail now. When we teach our courses, we go into the detail of why all this takes place and how it takes place. But if you have a scoliosis in the body, from a bite that's like this, you automatically always have a lordosis, going the other way, and you always have a twist in the spinal cord. Now I find that 70 to 80% of the people that came into my office just for general exams had a scoliosis, a lordosis, and a twist in the spinal cord because their bites were off, and they had symptoms, almost any kind of symptom you can think of. I had one fellow, he came in an exam, I looked at him, I said, do you have any problems? No, he says, well, I had a business in Seattle, and my doctor told me to sell the business because I couldn't handle the stress. So I came to Squim, sold my business, my wife supports me now, and I still have stomach ulcers. They told me if I quit and relaxed, I'd get rid of my ulcer. I still got stomach ulcers. I said, well, why don't I make you an appliance and level your bite and see what happens? It'll do you good. He says, go ahead and do it. So I made it, and in 2 hours his ulcer was gone. So he went to do experiments. He'd take his partial out that I made him, or his appliance out that I made him, and in 2 hours his ulcer would burn. Then he put it back in, and in 2 hours the burning was gone. So it was a 2-hour turnaround between ulcers and no ulcers, pain or no pain. Now that's extreme. Not everybody's like that. Most people it's just neck and pain. But then he was mad at his doctor now because he didn't have a business. His wife had to support him, and he didn't know what to do with himself. And he wore his appliance, and he was just fine. Well, that's just one symptom. But mostly what we're dealing with, people have chronic headaches, chronic neck problems, they can't turn, shoulders are hurt all the time, and the most common symptom is chronic fatigue. Because whenever the bite's off, you have all of these symptoms. And so that's what the aligner was originally developed for, to treat people in these what we call myofascial pain. All this pain is myofascial muscle and tissue that's pulled and torqued because the bite's off. Now I would say people that have all these symptoms and have a spinal cord that's torqued like this, I would say 70–80% of the time or more, it's in the bite. Now it can be from other sources. A person can get in a car wreck and they can get a shoulder torqued or they can get in a car wreck, or somebody can hit them in the head, or they can somehow get an accident where the cranial bones are knocked off so they're not level. Once that happens, that changes the bite, that changes the whole thing. They go to the craniopath and have get their head straightened out, and that can help them. But in most cases, the primary source of all those pains is coming in the bite. And it's so easy when the impressions are taken right, so we can mount the case properly on the aligner to diagnose where the symptoms are coming from, and then intervene with appliance therapy and then reconstruction in the body to solve their problem. A lot of the lab men that I've talked to on this, they don't have a doctor that's interested in doing myofascial pain. But if they're doing a denture, or they're doing a denture over a partial or something like that, if the lab man has an aligner and mounts on this, he can do the patient a great service just by doing the case so when it's put in the mouth, everything's level, and the patient will do better. This is just good practice for the dentist because his patients are satisfied with the work. Now, what I found out over years of doing a lot of denture work was if the denture is made crooked, like their bite was, in other words, the teeth on the denture itself aren't lined up level but are twisted or torqued, the patient always came into me with pain on one side. If the denture was high on one side, when they chewed, their jaw could move out to that side real easy, but when the jaw moved the other way, it was banging against the denture always, and they had soreness under the denture. When I would take teeth with people that come in with denture problems like that, and I'd cut all the teeth off the denture, put them on the aligner, put them back on level, put them back in the mouth, tell them to go home and chew, the pain was just gone. I didn't have to adjust the underside of the denture. I had to level the bite to get rid of the pain. So when the bite's off in a denture, or a denture in partials, or any significant amount of the teeth of the body are being changed, to do a service to the patients, either the lab or the dentist working with the lab, they should put the teeth in harmony with the rest of the body. So the rest of the body, the musculature and the fascial planes that go through the body can be balanced so that they can get rid of symptoms. So this is a great service. I know a lot of denturists I've talked to just use the aligner just to make their dentures because it's faster, it's easier, and there's a whole system for doing setting the teeth used in the aligner that's so much easier and faster than setting with a little hinge articulator or even an advanced hinge articulator like a Hanau or something like that, because you always have a reference point with the table, and so when you're setting teeth, you can set one or two teeth, leave and come back the next day if you want to, and you never lose track of where you are in setting the teeth. And generally speaking, you can set the teeth extremely fast and accurately with this instrument. Now there's other things that this instrument can be used for by just a lab man doing what a dentist wants him to do. Oftentimes, the dentist may say, well, I got this case mounted, but I want you to open the bite 2 millimeters. Well, this is perfectly horizontal, but if you notice in the body, the arch, the way the jaw operates, it operates on a hinge like this, and so it's not horizontal. Most people aren't horizontal. They're to some degree of a hinge like this. If the upper is level, it hinges down here. So if you were going to open the bite and open these up, if you open up 1 millimeter back in the back, it opens up 2 or 3 millimeters in the front. So if you were going to take a case, like a reconstruction case, and open that, when you open it up, you would like it to open it up level instead of opening it up in one area and then sending it to the dentist, and he has to grind part of this out to get all the teeth to meet. And so in order to do that, we have a pin. We have a pin right here that goes against this table. And when you turn that pin, you see that it opens up the front. Okay, so now if you were going to open the bite on somebody, and you want it to be level, so it takes very little balancing when you put it in the mouth, and you want to open the bite, you would open, on an average person, you would open it up so that 1/3 of the opening is back here in the back at the horizontal, because we have a way of opening the teeth in the back. If you look on here, if you turn this and set it, you would open it there. Okay, but then if that's set and you wanted to make the opening the way the body operates, you would actually turn this knob down and open this up. So now you would have, if you open up a 1/2 millimeter here and you turn this, you open another half here, you'd have 1 millimeter back here, but you would have 2.5 to 3 here. Okay, on the way you mount your case, if you were going to mount your lower to your upper. And I always mount the upper first and the lower to it. Okay, if you were going to close the case down, it was too far open, you wanted to close it down, you would set this up to begin with before you mounted the case, and then if you're setting like a full mouth case, then you would close this down 1 millimeter, 1.5 millimeters, whatever you want to determine, and then you would close the anterior down, and now when you mount the lower model to the upper so that you can reset, you've closed this down. You've closed that down so this whole thing goes up at an angle, because your jaws are at an angle here. So when you close this, it closes more like so. So you close more in the front than the back. So if you're going to open and close the bite on a articulator, you can use this to determine to do that, and then when you go to finish the case, it finishes outright with very little adjusting when you go to the mouth. Now on the aligner, we have a scale for the vertical mounting, opening and closing the whole upper unit. You can see there's a all charting here. We've got a scale that goes up and down, so you can close bites and open bites. Okay. We also have a scale. Once you've got a case mounted. Once you have a case mounted, you have a horizontal scale here, so you can actually move a case. Once it's mounted, you can move a case forward and backward. If you have a lower mounted to this upper, you can move it forward and backward, depending on what the case demands. For adjusting the occlusion, there we go. For adjusting, to check your occlusion on cases where you want inclines, 20 or 30 degree teeth, you have the scale on the bottom here. We got a scale in here, and you can adjust your lateral excursions very effectively with this instrument. Once you get teeth set, and I cover most of this on the course we teach on the use of the aligner, but you can set your horizontal. Say you've got everything set at 0 and all your teeth are set, and you want to set the lateral excursion. See if say you've got 20 degree teeth in a denture, and you want to see if the excursions work laterally, buccal and lingual excursions. Well, then I take this and move it up 1 millimeter. You raise it up 1 millimeter, close it down. Now you're not hitting right in the central fosses, and then you can do your excursions back and forth, and you can see how your teeth ride up the inclines, and and for cross tooth and cross arch balancing interferences when you're setting a denture or when you're doing full mouth reconstruction, so that they're balanced when you go to the mouth. So these are all the advantages you have using the aligner. You have horizontal advantage. You've got anterior posterior advantage, and you have the ability to set a guide for setting your angles of your teeth, 20 or 30 degree teeth on this. And whenever you're working with it, setting a denture or doing a full mouth case or going back and forth from one case to another on the aligner, you never lose track of where you are. You always have a little, when I'm setting a denture, I put a sheet of Post-it on here, taped on, and I set where I want my teeth according to how the dentist gives me a wax bite and where the wax is trimmed for buccal and lingual width of the arches, and I mark that on the table, and so that when I'm setting my teeth, I set to that mark, and so I can set them anytime I want to, as fast as I want to, and I never lose track of where they go. And if I'm going to do another case on the aligner, I just take that little sheet off, put it on the patient's chart or in their box, the case box, and when I go back to that case, I put that back on there, and I always know where the teeth belong. Or if the dentist comes back and says the teeth are set too far out, they have to be set back a millimeter, I've got that on this piece of paper I've got here, right where the teeth were set, and if they have to move them back, I can just put the case on here, move them back sideways, flare, whatever I need to do, and I never lose track. I can come back at any time and do that and never lose track of where I belong. So there's so many advantages just in general lab work to use this that are so much easier to do, and in many cases you can't even do that on a lot of the. In other words, you've got a fully articulated Hano articulator. You can't make all these changes after you get a case mounted. You have to make the changes in the bite or something in the mouth before you go here, because you can't do anything with the articulator. But on this one, you can mount a case in a bite that the patient has, and then change that on the articulator to what the patient needs. Now, I know there are a lot of instruments out that are geared to exactly put the maxillary arch or the mandibular arch the way it appears in the head. In other words, they want to be able to transfer a case from the head exactly on all the twists and torques onto the articulator. Well, to me, that's of no value, because what I'm trying to do is correct the body always. I'm not trying to keep the body where it is when it's already in pain, or when it's crooked, or when they've got scoliosis or lordosis, or where they've got all kinds of symptoms from anywhere headache to eye problems to neck problems to shoulder problems. I'm trying to correct that. I'm not trying to put that into the body. I'm trying to take that stuff out of the body to correct the body. So the aligner works for what I'm doing, to correct people rather than keep them in their present condition or worse. So that's the whole beauty of having one of these. The lab can do it themselves without the dentist, but it helps when the dentist and the lab work together. And if you're doing orthodontics, if you're an orthodontist or you're in a general practice and you're doing orthodontics for patients, to me, orthodontists fail, the teeth fail and they move around because there's no continuity between the way the teeth are set and the way the muscles are trying to move the lower arch in the body. And so if there isn't any synchrony between the teeth and the muscular system of the body, the muscles will always win and they will always move the teeth. And that's the biggest cause, as far as I'm concerned, what I've seen is why orthodontic cases fail. And the way you can prevent that is when you're doing your orthodontics, before you start, you take impressions and mount them and use the aligner as an analyzer to find out where the patient is. And then as you're doing treatment, you can level the upper arch, you can level the lower arch to the upper arch, and you create homeostatic balance in the body. And that's what the body requires. That's what the brain is always trying to do, keep the body in balance. And so our goal as dentists, no matter what kind of dentistry we're doing, especially if you're doing orthodontics or if you're doing full mouth reconstruction of any kind, I believe that if you don't want to have problems down the way, you have to be able to determine what has to be done to maintain balance in the body, homeostatic balance. Balance between the way the teeth operate and the way the muscles want to operate and what the brain's trying to do for the body. Now this has been kind of a short little example of what's necessary and what I feel the aligner is for. Teaching the courses, I teach courses quarterly usually, or whenever there's a group that wants to have a session. I do it here in my office. 6 people is about all I can do at one time. And we go through all the detail of what I've been talking about here. But this is just to give you a real quick bird's eye view of what the aligner is used for and why it's so important. And especially when the lab man has one and the dentist has one, they can communicate back and forth what they're trying to do for the body. So I hope this is beneficial for you. And I wish you well in doing your practice, wherever that is or whatever it is. And I would recommend using the aligner rather than any other articulator on the market, just for ease of use. I can tell you about one other case. I had a lab man that I used to work with doing denture work, and he had some very brilliant doctors he was working with that didn't feel they needed the aligner. But anytime they had problems with their cases, because they took very good impressions, he would mount the cases on the aligner and finish them, send them back, and everything would be just fine. So the lab man being able to use the aligner really helped out the dentist who didn't believe they really needed one. But he could do it, and it worked just about all the time, and he used to get a big kick out of being able to do this as a lab man. So those are things you can do as a lab man that can help your dentist out and make the dentist job in the office a little less complicated, a lot easier, and a lot more fun.